Good morning and welcome to another edition of United Way for Southeastern Michigan's What's the Word Wednesday. My name is Audrey Walker, and today we are joined by Sean Egan, Director of COVID-19 Workplace Safety for the state of Michigan. Just a reminder that the last 10 minutes of today's conversation are reserved for questions. So please leave your questions in the Q&A box if you're watching on Zoom or in the comment box on Facebook. Now I'd like to give a warm welcome to United Way's Manager of Advocacy and Government Relations, Amanda Klein, to say a few words.
Hello, everyone, and welcome to What's the Word Wednesday. Today we commemorate Workers' Memorial Day. 50 years ago, the Occupational Safety and Health Act went into effect, which promised every worker the right to a safe job. The law was won because of the tireless efforts of the labor movement who organized for safer working conditions. Our union brothers and sisters have fought hard to make that promise, I am so sorry, a reality, winning protections that have made jobs safer and saved lives. But if the last year has proved anything, there is much work to be done. The COVID-19 pandemic has had a devastating impact on our working families while highlighting the link between workplace safety and the health of our communities. We wanted to acknowledge and reflect on the tremendous courage, strength, and spirit of those workers who have been on the front lines. We are so pleased to be joined by Sean Egan, the Director of COVID-19 Workplace Safety, to highlight steps being taken to protect our workers across the state. A little bit about Sean. He's a lifelong West Side Michigander and an activist for working people and families. He served in the Navy and afterwards started an apprenticeship and became a journeyman electrician through the International Brotherhood of Electrical Workers. In previous roles, he has served as the president of the Kent-Ionia AFL-CIO Labor Council, sat on the board of the Heart of West Michigan United Way, dear to our heart, and most recently served as general counsel to IBEW Local 876. Sean earned a Bachelor of Business Administration from Davenport University and a Juris Doctor from Thomas M. Cooley Law School. Please join me in welcoming Sean to chat with us today. We're so happy to have you.
Yeah, thanks so much for having me. I think I'm quite of a nerd, for lack of a better word. So you kind of think through the steps of my life, and I think it's positioned me perfect for the situation that we're fighting right now, because I can bring the experience of being in a trade in the field and an apprenticeship, as well as my work representing workers and working with employers across industries to navigate a lot of tricky issues. And certainly COVID has been one of those. I would be remiss, I think, as Amanda mentioned, I was on the board of the United Way on the West Side for a lot of years. I helped when we were transitioning from sort of a general community chest to pillars or building blocks, or those focus areas. I focused in on the financial independence sector, really love that work. And to this day, I continue to be a volunteer with the Kent County Tax Credit Coalition and have done probably around 30 tax returns for low-income folks this year to make sure that they get those credits that they so much need. And anybody watching, I would encourage you to get into that program. It's a wonderful tool to bring money back into our communities across the state of Michigan. I'm also supporting the Lansing United Way, because a lot of these are doing virtual and have done tax returns in that space as well. And it's critical to make sure that Michiganders get the property tax credit, the home heating credit, and all of the earned income credit that they can, because that is money directly back into the economic activity of our communities. And it's a wonderful program, and you don't have to be an expert to do that. So please make sure that you take advantage of it. Very rewarding work, and you will feel great every single day that you do that. Amanda also said it is Workers' Memorial Day. April 28th across the country is Workers' Memorial Day, recognizing that people have fatalities at work, and we need to stop that. One of the primary reasons for the OSHA Act, or the MyOSHA Act, is to create workplaces that are free from recognized hazards. And we have a lot of standards and programs to manage that. And it's just critical that we all go home at the end of the day. And I think that we can make that happen if we work hard and make sure we're doing this type of education and outreach. But today, certainly I'm here to talk about everything that we have been battling for the last year as it relates to COVID in the workplace. And certainly there have been a lot of challenges. One of the major things that I like to remind everybody that this is a public health crisis that impacts workplace safety. So you have DHHS in the state of Michigan, the CDC nationally, and others really focusing in on how we cut the chain of transmission between people and things that we need to do. So you see a lot of news about that, but we can also bring that hazard into the workplace. As it relates to COVID, anywhere we're coming together is going to create a problem. It's going to create a challenge, and it's going to create things that we need to do to make sure that we protect each other. I think that in the news, we hear a lot about how this impacts me, but I would remind everybody, we have a responsibility to our communities too. So whether it's doing these things to make sure you don't get it, also think about doing these things to make sure you don't pass this along and to keep our communities safe. And while there's a lot of news and a lot of updates happening, we're all watching diligently. There are three critical pieces that have remained absolutely the same throughout this crisis, and that's the need for social distancing, wearing face coverings when you can't do that, and practicing good hygiene. The virus spreads primarily through large respiratory droplets and aerosols. Large respiratory droplets typically fall to the ground pretty quickly. That's why we need that distance. Gravity is going to be our friend to make sure that we're not passing it on to another, as long as we maintain that social distance. When we can't do that, we put on the face coverings to pull those back close to our bodies and help contain the aerosols we create when we talk, sneeze, breathe, sing, you name it, that can kind of move around more. So we've seen recently the CDC said outdoors is looking pretty safe. Indoors, you still need face coverings. Outdoors, they have some caveats. Don't just run out and take off your mask. It's if you're fully vaccinated and all that kind of stuff. But these tools have been the same. So when we talk about workplace safety, or the DHHS orders for that matter, they're built around those concepts. And you will see that over and over again. We're trying to maintain that social distancing, wearing face coverings or using barriers when we can't, and practicing good hygiene. So just keep that in mind as we talk through all of this. And what we've seen in Michigan across the pandemic is, like I said, anywhere we're congregating creates the potential exposures, especially when community transmission is high. So we see these sort of workplace outbreaks reported go up and down as community spread goes up and down because we're coming together. DHHS posts this data every week on the coronavirus website, so you can check it out on your own. When I report out and talk with groups, I pull out the places where there are a lot of non-employees, certainly still employees impacted there, but that would be schools, colleges, childcare, nursing homes, jails, prison detention centers, where there's a lot of non-employee activity. The numbers I like to focus on are the ones where we know that it is more than likely these are employees that are actually part of this outbreak. And as you can see on the 22nd, this comes in from local public health departments doing their contact tracing. They reported out 93 new workplace outbreaks, 12 of those in office settings, 32 in manufacturing or construction. Those numbers are linked up and we can't separate them. 20 in retail, 19 in restaurants, bars. And we're at about 13.7% positivity right now. That is trending back down, which is wonderful, but we have work to do. And they're tracking 405 ongoing outbreaks in workplaces. And certainly a lot of those are in areas where we might congregate. So over the since August up through the 22nd, we've seen workplace outbreaks, as reported, continue to be a significant contributor to the number of outbreaks being reported. I highlight offices here because there's been a lot in the news about offices, and so I'm not sure why that just skipped on you. Some of the things that we're trying to do to get back to a more in-person office space. That is important because our local downtowns are struggling. They survive off people coming into offices, and there's a lot of workers around those corridors that make their living for people coming into offices, but there's still challenges there. And as you can see from these reported outbreaks, the 3rd, 4th, 5th, and 6th highest are kind of in workplaces where we're congregating. So these mitigation strategies work. But we have to implement them diligently. I've been told by the public health experts that in 2020, we were playing against the junior varsity. In 2021, with the variants that you're seeing so much news about, we are playing against the varsity, and we have to be that much better about making sure we implement the mitigation strategies. Great news, though. Vaccination is going up. Vaccines on April 5th opened up to anybody 16 or older. If you haven't scheduled yours, please do. This is going to be the key to not only getting back to sort of normal just in general, but making sure our workplaces are safe and free from transmission of COVID. And what this very busy chart here, also available on the coronavirus website from DHHS, shows on the dotted lines is the percent vaccinated by age group. The solid lines are the case counts by age group. We started vaccinations in reverse order, protecting those most vulnerable, which is good. But that means that population are those top dash lines, 70 to 79 to 80 plus are at that 50+% through the 27th. And you can see inversely, their case numbers on the solid lines have stayed low even through this uptick. And that's good. That's what the vaccine's going to do. What we see with all of these other lines that are way at the top here is that is what I consider primarily the working age population, about 20 to 60. And we're catching up there, but we're behind. And that's really where we're seeing the case numbers. And there's a lot of reasons for that. It's not just the workplace, it's other things that we're doing. But as you can see, as we pick up vaccinations, we should start making some headway about leveling off and keeping cases low into the future. So that was through March 27th, before we opened for everybody. We were at about 15, 16, 17% for the sort of 20 to 60 year olds. And we're moving fast. So up through April 10th now, same chart, we see some leveling off in the case counts, but it's still that sort of working age population that is at the higher end. But we're seeing the 60 to 69 number of people vaccinated closing in on 50. We're seeing 50 to 59 closing in on 30, and we're seeing those case numbers start to make a dip. Some of this would just be the natural progression of how the virus ebbs and flows that we've been managing over the course of the past year. But what I'm trying to illustrate here is I'm not an epidemiologist or a doctor or an expert in all of that, but this clearly shows us that vaccinations work and that this is going to be critical to making sure that our workplaces are safe and people can start coming back. Now, a lot of workers, I want to make that clear, a lot of workers have been in person. The vast majority of workers in Michigan have been in person, and there's a lot of reasons for that. That's where the production is, that's where the customers are, that's where things have to happen. That has included people coming into offices. So we don't want to underestimate the number of people that have already been out there and focused solely on remote work and things like that, because there's a whole lot of people that that's going to apply to. But those mitigation strategies absolutely work to do that. A lot of news recently about the MyOSHA emergency rules. Federal OSHA never put out a standard. So it was important for us in the state of Michigan to ensure that MyOSHA met its mission to protect the health and safety of workers in the workplace and keep them free from recognized hazards. Free from recognized hazards either means you can get rid of the hazard, which is the best thing you could do, or you mitigate it. So that's the masking, distancing, health screenings, all those things that you're dealing with. Those were extended. We've been saying publicly that this is COVID. It's hard. Things are going to change. We know that. There is some flexibility within the rules for us to make some updates. As an example, if you are fully vaccinated and you have a close contact, you may not need to quarantine. Those are things we can update. There's flexibility in the rules, and we post that on our FAQs and try to get the information out. So many of the strategies are pretty standard, keep that distance and that kind of stuff. And then, we're going to continue to work forward. One thing I have highlighted is that we've heard from employers often that is we're banning in-person work in offices, and that's not the case. Employers have to create a policy, and the employer is determining which employees can or cannot necessarily be in that workplace based on what we call feasibility, which means it's going to consider the economics, technical aspects, and everything that goes along with that. And we talk so much about remote work. I'd just like to point out that this is ongoing guidance from federal OSHA, CDC, and MDHHS to consider these strategies just to try to help us avoid that congregation. In those workplaces where it's possible to stagger shifts, whatever it is, to avoid the density of people that are together is going to help us mitigate the spread of COVID. This video always auto starts on me, so I'm going to pause it, but of many of the things that we have been doing here in Michigan have been directed towards making sure employees understand how to access these protections and rights. I'm just going to leave it there, as well as consulting with small business. We did a quick check for some work we were doing recently, and I have personally done 78 webinars like this since August. And many of those have been live Q&As where we're talking about COVID workplace safety, directed at small business, directed at employers, working with associations. reaching out to employee groups the best that we can. Employees are always harder to get to than businesses. So we try to make sure we're accessible. We've done them in the evening, you name it, to just make sure we keep getting the word out there. And that last slide, what you saw is we also developed what we call the ambassador program. There are a lot of businesses in Michigan that, for whatever reason, you know, they don't really interact with MyOSHA a whole lot. They're covered, but maybe the hazards are low. Think of like a restaurant, right? The hazards are lower. There's probably not a lot of complaints in normal times, but with COVID, everything sort of changed. So we developed a free consultation program, not enforcement, to reach out to small businesses across the state of Michigan, mainly focused on restaurants, bars, retail, gyms, fitness centers. We've recently opened that up to certain types of office environments too. We have two. There's one that's a pop-in where they'll run through with the manager or the owner a 10-question checklist, kind of give them you know, hey, here's things you can do. That doesn't come over for citations or anything. And then there's a longer consult that employers can request. And if they do, they get a nice window cling that says they've participated in the ambassador consultation program, trying to boost confidence for customers as well. So we launched that around October, and we're over 3,500 consultations across the state of Michigan. Probably about 500 or so are in that longer consultation. 3,000 or so are in the shorter consultation, and it's a wonderful program that's been very, very helpful. And then we have resources available. MyOSHA launched in like May a hotline at 855-SAFE-C19 for employers or employees about COVID workplace safety. Around the beginning of June, we launched the COVID workplace safety website where we have the emergency rules, guidelines, posters, anything you could need, we have there. That is also where we update our FAQs as things change. As I mentioned, there's flexibility in the rules when you get into, you know, quarantine, isolation, some of the other things, and we're going to be updating the best that we can when CDC updates, and we are flexible enough to be able to update the rules themselves if we need to as conditions change. I think there's some thought that because we put them out there, we can't touch them, and that's just not the case. We're watching them all the time, and as conditions continue to change, we're going to manage that. So, you know, the tools you need, anybody needs are there, whether you're from the employer or employee side. We are trying very, very hard to make sure that we communicate often and regularly. I make myself way too available to everybody and try to make sure that we can be a resource. One of the things that we're really working to do as we've launched Workplace Rights Week this week is to make government more accessible to everybody, recognizing that employers need to understand this just as much as employees do. Our labor laws in Michigan, including MyOSHA, really have an obligation for the employee to engage. Wage and hour, workers' comp, all of those are the same. The employee has to take a step to engage those rights, and we really want to make sure that people know how to do that. So
Definitely.
So I'll stop. As you can tell, I've developed the ability to talk forever now, so I'm going to stop there, and we can open it up for questions.
It's great when we have people on that are so passionate about what they do and can really talk for a while. And I'm happy to, you know, have you here and start our Q&A. So if you're watching and you haven't done so yet, please put your questions in the Q&A box as well. But just curious, you know, how do the rules differ among different industries? And then how are those established? Because you mentioned, you know, different, you know, agencies that are making recommendations. And then you mentioned ways that employers can, you know, mitigate the spread. But, you know, how do the rules differ among different industries?
So two pieces there. MyOSHA has authority over the workplace, employee-employer relationship. DHHS's guidance is more directed at public health and safety, and it certainly impacts certain types of workplaces. So normally what I tell employers to do, we have a template preparedness and response plan available too on the COVID workplace safety website. When I talk with restaurants, bars, and others that are more impacted by DHHS orders, my recommendation is to get our rules, get that plan, get that all in place, because we want those to be relatively static, and they have been. And then layer in the pieces that you might see changing from DHHS, because it's only going to touch little pieces of what you do. So when we think of a restaurant or bar, they're going to or an office or anybody else, but they're going to be covered by the rules in general. So when we open up the OSHA rules, covers every workplace, and then we have some industry specific lines that kind of get a little more detailed. So that restaurant, bar, office, whatever needs to have that basic outline of basic infection control. That's to maintain social distance, wear face coverings if you can't, in-person meetings, all that kind of stuff. We don't have capacity limits in there. That gets confused a lot. And then just where we went in the rules to industry specific, just trying to recognize specific challenges within certain industries. So you'll see on like construction, you think of a construction site, sometimes you see a fence and everybody goes through the same little slot, and sometimes they're just open and people walk in from any angle. So we talked about creating dedicated entry points and things like that to make sure that people are doing the health screenings and stuff. And then when we got into a few other locations, we were trying to recognize where the hazard was. So if you think about a place that's generally open to the public, you can be doing health screenings, requiring your employees to wear face coverings and all those types of things, and then your customers might bring the hazard. So we tried to identify things where where's this hazard and how do we mitigate it? So there is some impact there, but overall it's primarily between the employer and employee. And then DHHS will have some pieces that touch on everybody because they're trying to control across all of the public kind of how we're interacting.
Mm-hmm. And so as far as employer and employee, then, what should I do if I know my employer isn't, imposing any sort of COVID safety guidelines, or how would I then, I guess you could say, like, process,
Sure.
a complaint as an employee?
Yeah, I would suggest that you can do this two ways. Well, you could do it a couple of ways. But the first thing I would recommend, especially with COVID and the rules, is try the hotline. That 855-SAFE-C19 hotline is for employers or employees. They can talk with you about what your issue is, because certainly there's a lot of confusion, right? And maybe your employer is doing it right. I mean, a lot of employees aren't really going to know that, right? So talk with those folks. If you need to file a complaint, they will get you over to the complaint process. If you don't, maybe they answer your question and it makes more sense, then you're good. You can also go to our website. Excuse me. The OSHA website has a link to file a complaint. You can do that online. You can remain anonymous. You will have to put in your name and information so that the investigator can contact you to talk about what your issue is, but they won't disclose your name to your employer. So you can do that anonymous. You want to definitely make sure that there's a little spot in the box to kind of lay out what your issue is. You don't have to be perfect. Just have enough there so that the investigator can understand sort of what your issue may be, and then it'll work that way as well. But and you can certainly also do a physical form. I don't know if anybody does that anymore, but you can do a physical form. We also have a link to another tool there. We call it a discrimination claim. That's actually a retaliation claim. It's called discrimination within the OSHA statute. So employees are protected from retaliation, discipline, or discharge and that kind of stuff for raising these types of concerns, for participating in an investigation, talking with investigators and those types of things. Very short time limit on that, though. It's got to be filed within 30 days of the action, whatever the employer might have done. So we have, we know that employees like to file anonymously, but you also have some protections there as well.
That's really good to know. And are there specific quarantine guidelines to return to work following if there is a known COVID-19 exposure at the workplace? Is that like a standard protocol, or does it vary by employer and industry?
So I think the answer is yes. So I think the question gets to critical infrastructure industries. We know there's been a lot of news between kind of all of us and then those that are in these particular industries. And some of that is manufacturing, energy, water distribution, several others, food production. And there are some differences within the CDC as it relates to how you manage quarantine or isolation. So if you're in one of those critical infrastructure industries, there may be some differences. We do have that posted on our FAQs, exactly what that lists. I would remind everybody too that This is not enforced by my OSHA, but there was a Public Act 238 and then was amended with Public Act 339 in Michigan that, creates a duty for employees not to show up for work, and then has some provisions for employers not retaliating on that. And that has some industries listed as well. So that could be different than those critical infrastructure pieces, but definitely something people would want to check out.
And so then if an employee refuses to work because of a COVID related situation, whether it be, I guess in this instance, at the workplace, are they still eligible for unemployment? How does that work?
So there have been a lot of changes in that space over the last several weeks, and I wish that I could give you an exact answer on it, but I have to circle back to make sure that we give the correct answer for folks that need the unemployment assistance. I would remind any employers that you work with are eligible for tax credits if they provide paid leave. If we all recall, up through 2020 to the end of the year, there was an obligation for employers of a certain size, 500 or fewer employees, to provide protected paid leave. Anybody ring a bell, anybody? The obligation for employers went away, but the tax credits were extended out, I believe, until this September. So employers can voluntarily offer that as paid leave and get tax credits dollar for dollar for the amount of leave that they're taking.
That's a great reminder as you bring that up. And we are going to wrap up the questions, but we really want to thank you for joining us today and sharing this important information about safety in the workplace. We want to make sure people are safe in the workplace, and then providing the resources you have to let people know, where they can go to find more information or reach out about different situations they're experiencing. So I'm going to turn it back over to Amanda now to say a few words.
Thank you, Sean, again, for being with us here today to help us learn a little bit more about how to stay safe in the workplace, and to also help us acknowledge, Worker Safety Day. It's an important day. As a reminder, for those of you who may be experiencing a need, our 211 helpline remains available 24 hours a day, 7 days a week. We maintain a running list of available services in the community and can help connect you to the supports you need. You can also look up resources in your area by using our 211 resource database at unitedwaysem.org/211. We are also excited to announce that United Way has launched our first ever 21-day equity challenge. The challenge will take place starting May 21st through June 18th. Participants will receive emails every weekday filled with videos, articles, and infographics to broaden our collective understanding of the history and current issues surrounding racial inequity and what we all can do to move our community forward. Additionally, there will be opportunities to engage with fellow participants and share what we've learned in virtual events throughout the month. You can sign up today at www.unitedwaysem.org/equity challenge. Our next town hall, we will be joined by Michael Senti with Wayne Metro and Kelly Rose with MSHA to discuss eviction protection and the SARA program. To see our previous town halls and more upcoming topics, please visit unitedwaysem.org/virtual town halls, and the website is included in the chat box. Thank you, everyone, and stay safe, and we'll see you next Wednesday.